Nadine Riegel from 5 West Medical Surgical Unit, and she is co-presenting with Emily. And the title of their project is Effects of Nurse-Physician Collaboration Rounding. Welcome. Right.
We're presenting on effects of nurse-physician collaborative rounding. So there is frequently a perceived miscommunication between patients, nurses, and physicians. There are situations where nurses find themselves calling to clarify orders frequently, or maybe lack of orders. Patients frequently state that they feel as though physicians and nurses are telling them two different things. And sometimes nurses will come into the room and they will ask for a medication that the physician had told them about, but they didn't put an order in or they didn't put a note in. And discharge information, such as if the physician said you'll leave today, but maybe the physician didn't know about them not having a bowel movement in several days, or just things like that. So this miscommunication can lead to interruptions to the physician and nurse's workflow, constantly having to make phone calls and the physicians having to answer the phone calls. It can delay patient care, whether they need a wound dressing order and then we have to wait on the order and there was a window of opportunity and we didn't get to do it when we had time. It can also, like I said, delay discharges. If the nurse knew that the patient was going to discharge earlier, maybe they could have reprioritized their day to have a more smooth transition. It can lead to medication errors, and that can lead to patient safety issues. And also, this miscommunication really leads to frustration for the nurse, physician, and patient. So how can this perceived miscommunication be avoided? From the nursing perspective, we think that collaborative rounding, having the patient, nurse, and physician be on the same page in the morning while they do their rounds, can really help with this miscommunication.
So according to the Joint Commission, the lack of communication between nurse-patient has been one of the major factors shown to be part of sentinel events that are reported. So one of the things that can help improve this is to have nurses and physicians participate in interdisciplinary collaborative patient rounds. So for our intervention, we have made these signs that will have a picture of the nurse on them, their telephone number for the day, and then a brief statement requesting that the physician find us or call us so that we can help them participate in the patient rounds. So our basic goal is to basically improve communication, but that's a little hard to measure. So we're looking at decreasing the amount of phone calls between the nurse and the physician, improving teamwork and patient safety, and then hopefully improving our HCAP scores in nursing communication, physician communication, and staff teamwork. So for our projects that are shown, 5 West has completed the intervention and the post-implementation section, and as of right now, 10 West and 12 West have just started implementing the intervention. So we're hoping to get more data once they have completed the intervention and collected everything. So that's how that's going. And unfortunately, I don't really have any data to share with you at this time, but I can tell you from my experiences having the sign posted, I feel like it has really improved communication, not only amongst the patients, but between me and other members of the healthcare team, including the lab and the therapy and patients' family members and everything. So that's our project.
I have a question for you.
Yes.
I actually took a picture of one of these signs on the door last week because I thought, you know, in addition to helping the communication with physicians and the rest of the healthcare team, it'd be great for that wife going in the room. You know, your name's in there, but she knows what you look like, so she can like go out and like find Crystal.
And I've actually had a lot of family members come in and they see the sign on the door and they immediately just call me. And they're like, well, it says on the door to talk to you, and I'm like, well, it's actually for the physicians, but if you need to get a hold of me.
Where did that idea come from to post that on the door?
There's actually a study that was done, I'm not quite sure where, but they had suggested making the sign and everything, and so we based it off of that study.
Any reluctance of your staff to participate?
Yes.
in that?
She has had the trouble with the staff.
Sorry, y'all wanted me to ask that question.
10 West had a couple of, they were concerned about safety issues, but actually one of the people that had the biggest reluctance about putting their picture and name up, they're actually loving it now. And then I know 8 West actually is not using pictures, so it'll be interesting to see the comparisons of the units that use the pictures. Because also we had a physician on our team, and he really liked the idea of the picture because he felt like he was getting to know the nurses better. And I think even just building that relationship between the nurses and the physicians can have really great effects as well.
So do each of you just have like a stack of pictures and you put them on your doors? Is that it? Do you do that on night shift as well?
We decided to do it on night shift. They were more reluctant because they didn't see the point, but they're starting to come around, and you know, some of those residents come super early in the morning, and it's really helped with, I think, being with, what is it called? Bedside, like
bedside
reporting. They have a little more clear of a picture sometimes once they've talked to that resident, because usually they just don't talk.
Yeah. Yes.
What was your data collection? What's your baseline data? What are your measures?
We're measuring how often a nurse has to call the physician or how often a physician calls the nurse. And then we're looking at if the nurse was included in that round, and also what reasons the nurse called or talked to the physician. Like if it's a clarification for an order, like they told the patient they would order this and then they didn't, whereas if it's a change in the patient condition, because we can't really control if we have to call them for that.
So each nurse almost has like a tally sheet.
Yeah, we have a tally sheet that.
It's self-reported.
Yes. Yes.
So what did it do to your HCAP scores?
Well, it did improve them in nurse communication and staff teamwork, and then I don't know if I'm allowed to talk about what our phone calls were, but it did decrease, significantly decreased the amount of phone calls on 5 West. So. Thank you. Thank you.